Hey everyone, welcome back to Shock Doc Medical. I'm Dr. Rod, and today I've got a really intriguing topic that might just change how you look at skin rashes. Have you ever noticed a rash that seems to be drawn in a straight line or has a razor-sharp cutoff? What if I told you that these patterns might be the key to unlocking whether the problem is coming from the outside or inside the body? Buckle up, because today we're diving deep into the fascinating world of linear patterns and sharp demarcations in dermatology. Now, let's break this down like we're chatting over coffee. When you see a rash that's linear or has a clear, defined edge, the first question you need to ask is, could something external be at play? Think about it. Could it be the pressure from a tight waistband, an excoriation from scratching, or even brushing against a plant? These external forces tend to produce asymmetrical rashes that just don't follow the natural flow of the skin. Here's where it gets interesting. Sometimes these rashes aren't just random. Some inflammatory skin conditions, like lichen planus, psoriasis, or even vitiligo, can actually develop along lines of trauma, a phenomenon known as the Koebner phenomenon. Basically, when you scratch your skin, you're not just irritating it. You could be triggering a response where the rash appears right where the trauma occurred. And it doesn't stop there. Cutaneous infections like viral warts or molluscum contagiosum might even auto-inoculate into a scratch. So always ask your patients if there's been any trauma, like scratching, that might be influencing the pattern. Now, if you've ruled out external causes, it's time to think deeper. Remember what the great skin pathologist Ian Wimster once said? Some invisible intersegmental boundaries, whose existence we have been taught to expect by comparative anatomy and embryology, are only revealed by disease. In other words, sometimes the rash is telling you something about the internal layout of the body, something you wouldn't see otherwise. Let's shift gears a bit. Another key element is understanding venous and lymphatic drainage. Ask yourself, or the patient, does the rash follow a vein or a lymphatic path? For instance, if you have conditions like stasis dermatitis or even vitiligo, they might show up along varicose veins. And don't forget thrombophlebitis, that often presents with tender nodules right along a vein. Then there's lymphangitis. If you see that extending red line, it's typically a sign of cellulitis, but it could also be from infections like sporotrichosis or even a malignant infiltrate spreading along the lymphatics. All right. Moving on to something every clinician should know, dermatomes. A dermatome is basically the patch of skin that's supplied by a single spinal dorsal nerve root. Here's the kicker. Almost every part of our skin is innervated by more than one spinal nerve, so these dermatomes overlap quite a bit. However, there are exceptions, especially along the ventral axial line. And if you've ever had shingles, you know it well. Herpes zoster loves to follow a dermatomal pattern, leaving you with a very distinct band-like rash. Speaking of the ventral axial line, this is a fascinating embryologic boundary. It marks the border between the C5-C6 dermatomes and the C8-T1-T2 dermatomes. What's wild is that there's no crossover of sensory nerves along this line. This means that sometimes you might see a drug line in morbilliform drug eruptions, where, say, the T1, T2, and T3 nerve areas are involved, but the adjacent C5 dermatome is totally spared. It's like your skin has its own built-in border control. Now let's talk about pigmentary demarcation lines, also known as Voigt-Futcher lines. In about 20% of people with dark skin, you'll notice a natural demarcation between darker skin on the dorsal side and lighter skin on the ventral surface. These lines usually align with the ventral axial line we just discussed. They're completely normal variants, but can sometimes look pathological if you're not aware of them. Ever heard of Blaschko lines? These are not your typical dermatome lines. Instead, they represent the pathways followed by keratinocytes as they migrate from the neural crest during embryogenesis. Picture a V shape over the spine, an S shape on the front and sides of the trunk, and a neat linear pattern on the limbs. When you see inflammatory conditions like lichen striatus, linear lichen planus, inflammatory linear verrucous epidermal nevus, ILVEN, or even Blaschko dermatitis, which might be the adult equivalent of lichen striatus, it's a strong hint that you're dealing with keratinocyte mosaicism. And there are even rare inherited conditions like incontinentia pigmenti and Goltz syndrome that follow these lines. Sometimes the lines you see on the skin are linked to congenital anomalies, specifically embryonic clefts. These occur along the midline and are associated with the lines where embryonic tissues fuse together. It's a reminder that our developmental history can show up on our skin in unexpected ways. Next up, the Wallace line. This demarcation is found on the lateral aspects of the palms and soles. It marks the boundary where the glabrous, hairless skin of the palms and soles meets the hair-bearing dorsal skin. Certain inflammatory conditions, like lichen planus, pompholix, which is a type of vesicular eczema, and even the rash seen in Kawasaki disease, can display a sharp cutoff right at the Wallace line. And lastly, let's not forget about the Langer lines of cleavage. These are the natural lines that you'll find running through the skin, which can often guide surgeons in making incisions that minimize scarring. Although our source here just tells us to see EP8 for more, it's an important reminder of the inherent patterns in our skin structure. So to sum it all up, when you come across a rash with linear patterns or sharp demarcations, start by considering external causes like excoriation, pressure, or plant contact. Look for the Koebner phenomenon in inflammatory conditions, and always ask about any history of trauma like scratching. If external causes are ruled out, delve into internal explanations. Think venous or lymphatic drainage patterns, dermatomes, and even embryologic boundaries like the ventral axial line or Blaschko lines. And remember, sometimes what looks pathological is just a normal variant, like those pigmentary demarcation lines in darker-skinned individuals. Now, I know we didn't dive into specific treatment regimens or medication dosages here, because this particular discussion is all about diagnosis and understanding the patterns. But for those of you in clinical practice, having a solid grasp of these concepts can really help you determine the right next steps, whether that's further investigation or targeted therapy based on the underlying cause. For instance, if you're dealing with an inflammatory rash due to a known external cause, treatment might be as simple as addressing the irritation or even using topical agents. But if you're seeing signs of something like thrombophlebitis along a vein or lymphangitis in cellulitis, you'd be looking at more specific management protocols with antibiotics or other interventions. Always tailor your treatment to the individual patient, and if you ever need a refresher on dosages, refer back to your trusted clinical guidelines. All right, folks, that's a wrap for today's deep dive into the fascinating world of dermatologic patterns. I hope you found this breakdown as eye-opening as I did. If you learned something new, or if this sparks some ideas for your practice, hit that like button, subscribe to Shock Doc Medical, and drop your questions or thoughts in the comments below. Let's get a conversation going. I'm all about building a community of curious minds who are passionate about medical innovation. Next week, we'll be exploring another groundbreaking topic that might just change how you approach everyday clinical challenges. Until then, I'm Dr. Rod, reminding you to stay curious, stay informed, and as always, keep pushing the boundaries of what's possible in medicine. Take care, and I'll catch you on the next episode.